Hello, good evening. Friends, welcome to this edition of YouTube Live. I'm Dr. Ramen Goel. I'm a bariatric surgeon in Mumbai at Wakad Hospital, PD Hinduja Hospital, and Zen Hospital, Chembur. Today I'm going to talk on an important issue which is generally overlooked because when we talk of bariatric or metabolic surgery, everybody thinks that this is a weight loss surgery. But from 2004 onwards, it has been realized that this surgery has a very significant impact on diabetes, irrespective of weight loss. So, what that means is that if you undergo a metabolic surgery for only diabetes, then you may not lose more than 5-7 kgs, or you may lose a limited amount of weight if you are not very heavy. But your diabetes can get controlled within a week or 15 days. So I wanted to share that because almost every family has one or two diabetic members or their friends who have diabetes. And even though there are so many good medicines, but almost 60% of diabetes persons remain uncontrolled even after taking medicines regularly. And these people are likely to have serious complications of diabetes. They are probably the worst complications of a disease like heart attacks, kidney failure, blindness. People have brain stroke. People have amputations of their feet, because there is no nerve sensation. So I'll start my presentation. I'll share my screen to show you how exactly what I mean. So bariatric surgery, which is also called metabolic surgery, is an independent treatment option for obesity and diabetes both. And these are the places where I work. Now, before I go for diabetes management, a brief introduction about weight loss with bariatric surgery. So why bariatric surgery is required? Because somebody who is overweight and takes an option of diet and exercise or a lifestyle measures, they usually lose 5 to 10% weight, and almost all of them regain weight within 1 to 3 years. So though the lifestyle measures do work, but in long term, they are not sustainable and thus leads to a failure of weight loss with these measures. While with bariatric surgery, people lose almost 70 to 100% of their excess weight. Now, this is very important. People do not lose excessive weight. If they are 30 kg overweight, they will probably lose 25 to 30 kg. If they are 10 kg overweight, they might lose 5 to 7 kgs. And most of them are able to maintain it long term, almost 80%. So bariatric surgery is probably the only effective long term weight loss treatment option. In bariatric surgery, no fat is removed from the body. What we do is we reduce the size of the stomach so that the person feels full after a meal, and thus they lose weight from all over the body. And this helps in improvement in all associated diseases, including diabetes. Now, these are the common bariatric procedures. Most of you know this. This is sleeve gastrectomy, where we remove the part of the stomach. This is gastric bypass. We make the stomach small and join it to the intestine. And this is another type of bypass where we make a sleeve-like stomach and do a bypass. Now, all these are good treatment options for weight loss, but they are also good treatment option for diabetes. So that's very important to realize that they are also metabolic surgeries. Now, most of these surgeries are done through a keyhole route. Takes about less than 1 hour most of the times. They are allowed to drink, allowed to walk on the same day, and they can go home within a day or two. Now, it's important to realize how surgery works. Many of you have sent questions that do we change pancreas? Do we do something to do pancreas and all that? It's not actually that. When we do a surgery, it changes the hormones inside. So there are hormones secreted from the intestine which makes your body's insulin effective, which work on pancreas and makes them effective. There are also change in gut bacteria which are considered very important for diabetes treatment. And obviously there is limited food intake, and thus all these together works for weight loss and also for diabetes. Now, these are the international guidelines modified for Indian patients or patients of Indian origin, that if somebody is just about 8 to 10 kg overweight, suppose somebody's height is 170 centimeter, he's about 80 kg, he can undergo this surgery if the diabetes is not controlled. So basically this surgery can be done in people who are just 8 to 10 kg overweight and who have a uncontrolled diabetes. 15 kg overweight, they can have this diseases like blood pressure, anemia, like PCOD. And if they are about 25 to 30 kg over, can have this if they have no other disease, because obesity is a disease. These people usually lose 10% in first month, then 5% every month. They end up losing 70 to 100% of their extra weight within 1 to 1.5 years. Just to show you, this person who was 144 kgs, young man, 27-year-old, and he came down to 69 kgs and looks so different from what he was before surgery. Now, there are various endoscopic methods which are basically for weight loss for people who are not very heavy, like a balloon, which is put endoscopically and where the stomach size gets reduced from inside. There is no surgery in this, and these people typically lose 10 to 15 kgs. Or there is endoscopic gastroplasty, where we can stitch the stomach from inside, and thus the stomach, which was like this earlier, has become small, and these people also lose 10 to 15 kgs. So these are basically the various endoscopic procedures, laparoscopic procedures for weight loss. But the endoscopic procedure, do they maintain weight long term, is a matter of debate. Now, there are many studies like this. Studies going on in Sweden for more than 20 years, and they have shown that those who had this surgery, the diabetes got resolved or went into remission in a much higher number than those who were receiving the medical therapy. And this is not about diabetes remission. They also had significant reduction in diabetes complications in surgery group. We have also published our data which shows that at 3 years after a metabolic surgery, 80 to 92% patients had diabetes resolution. They don't need medicine for diabetes. Their sugars remain normal without medicine. Almost 65% of them maintaining remission at 5 years. That means their diabetes is still under control without medicine. And at 7 years, 56% of them are still maintaining their remission. Now, how does the diabetes improvement happens? Because so many questions have been asked. I'm going to speak in general, and then maybe you can send questions to me. That insulin discontinues within 1 week. And if somebody is also taking tablet, then tablets can stop within 1 to 3 months in most. Just to show you, this gentleman who had a surgery long time back was on insulin before surgery, and he lost weight, and all his medicines, insulin stopped in a very short time after the surgery. Now, as I was mentioning, this is not about sugar control. It's more important in terms of complications of diabetes. So this study, which was published in August 2018, shows that 5 years after bariatric surgery, there is 1/3 reduction of diabetic eye problems, 50% reduction in diabetes-related kidney problems, and 2/3 reduction, almost 66% reduction of diabetes-related nerve problems, and 40% reduction in diabetes-related heart attacks and deaths. So, for diabetic patient, this surgery is like a boon, because this can help them control their sugar better, and it can also help them in in avoiding diabetes complications in long run. Just to show you this lady who was 62 years when we operated her almost a few years back in January 2018, 4 years back, and she was on insulin for 10 years. She was diabetic for 25 years. And even then her sugars were not controlled, as you can see. We did surgery, and second day after surgery, we had to stop insulin because her sugars had come down. And even long run, her sugars are well controlled without insulin, and she's maintaining her weight. So it's so important to realize there are various other benefits, like there can be resolution of sleep apnea in 95% patients, acidity or reflux improves in 65% patients, joint pains improve in almost 55% patients, and women who have irregular periods or PCOD or infertility, it improves in 70% patients. Just to show you another patient of ours from Kenya, he was 155 kg, severely diabetic, and he lost weight, and also his sugar got controlled, and all these issues improved. So this has a major impact. Then this young lady who was 21-year-old, operated in 2012. She was 120 kgs, lost almost half of her weight, and she's maintaining it and has no more health issues. Another young girl who had a surgery a long time back, almost 13-14 years back. She was 121 kgs, lost 50 kgs, and then she delivered 10 years after the surgery and had a very healthy pregnancy and healthy baby. Now, important thing to realize is that these surgeries have long-term benefits. So there are short-term benefits, that insulin can stop within 1 week, medicine, most of the tablets stop within 1 month. But long-term benefits are that patient doesn't need to diet. They can do mild or moderate strength training exercises to maintain their muscle mass. And for better results, they can reduce or avoid alcohol and avoid calorie-dense food. And this helps in maintaining their blood sugar long-term. Just to show you this lady, we operated in 2009. She was 107 kgs, lost some 37 kgs, and is maintaining weight even after 12 years. Now, people have apprehension that whether they can swim, whether they can exercise, but we advise them to go for long walks. 7 days after surgery, they can go for long walks, they can swim, they can join a gym at 1 month after surgery, they can do abdominal exercises 3 months after surgery. And these exercises helps in increasing pace of weight loss and also help in maintaining their weight in long run. Like this gentleman who had a surgery, lost about 50 kgs, and then he took marathon running as a hobby. And he's running a marathon in Amsterdam for his company. So people can go in a different trajectory, different phase of life, just because they have lost their weight or they have better control of diabetes after surgery. Now, there are a lot of apprehensions about safety of surgery and what are the risks involved. Any surgery might have some risk involved, but what I have seen in last 22 years since I'm doing bariatric surgery is that safety has improved drastically over a period of time because of more experience, better technology, better drugs, and better understanding of disease. And thus the risk of surgery is now similar to the risk of a gallbladder surgery or a hernia surgery. And it has been seen that the risk is low at high volume centers. So those hospitals or centers who are doing at least 100 surgeries a year, the risk of surgery is as low as that with a gallbladder surgery. And then these patients also need support from the bariatric program. So this is one of the support group meeting where we have 100 to 150 patients or more who come together, they interact with each other, And nowadays we have virtual support group meeting. COVID has taught us how to approach, how to conduct a virtual meeting. And so people from different countries can attend the meeting, and they don't need to travel to us for follow-ups. This is important, friends, because from 1st October 2020, insurance in India is covering all insurance companies are covering bariatric surgeries now, irrespective of their policy. So the only condition is that the person should be at least 18 years of age and should have BMI of more than 40. Now, this is different than the Indian guidelines, but this is the insurance guidelines. So BMI should be more than 40 without any disease, or more than 35 with any of the following. So that means if they have a cardiomyopathy, that means their ejection fraction is less, or if they have coronary heart disease. So if they had a coronary heart disease in past, like they had a heart bypass surgery or a angioplasty or a stent inside. If they have severe sleep apnea, that means if they snore at night, or if they have uncontrolled diabetes. Then if these 4 conditions are there and the BMI is between 35 to 40, then insurance will pay, or insurance will pay if it's more than 40, even without any disease. And the effect of this is that almost 80% or more surgeries that we are doing nowadays in Mumbai are done via cashless route. Same thing applies for international insurance companies also, because they have been covering insurance for bariatric surgeries for a very long time, and people have been getting it done in India through those international insurance. So friends, I would like to conclude now. These are our contact details. Our Center of Metabolic Surgery is a center of excellence in bariatric and metabolic surgery. Very few hospitals in India have this kind of recognition, which ensures that which assures you that the quality of care is the same as that of best centers in the world. So I think this is an important determinant of quality and outcomes. So if you get it done in a center of excellence, the outcomes are at par with the best in Western countries, and the service quality is assured. So thank you so much. I'll stop my screen share. I'll be very happy to answer questions if you have any. And so the first question has already come. So Harshita is asking, does diabetes go away after bariatric surgery? Harshita, diabetes doesn't come, doesn't go. We only know that somebody has diabetes if his sugars are high. Okay, there is no test which says this person has diabetes even if sugars are normal. So what happens after surgery is that your sugars remain normal without medicines. So, and that remains for years, as I've shown, 10 years, 20 years, the sugars can remain normal without medicine if you are early diabetic. And so the question is the diabetes there if sugars are normal? I don't know. But these people will have a life like a non-diabetic person who is not taking medicine and instead sugars are normal. Another question is from Prapti. Does obesity cause diabetes? Prapti, we know that obesity leads to increasing amount of diabetes. So people who are overweight are likely to have diabetes more frequently than somebody who is normal weight. But exact correlation that obesity is causing diabetes has not been established. So there are many people who are lean and thin and they also have diabetes. So it's very difficult to answer your question because it's not there. We don't know the answer, honestly speaking. But definitely diabetes is seen more frequently in people with obesity. There is a question from Akash. Does bariatric surgery reverses diabetes? Yes, Akash, in a way, because what happens is that, suppose we all know that initially in diabetes we start with tablets, then the number of tablets increase, then insulin is required, and then insulin dose increases, and this goes on for years and years. Now what happens after surgery is that the sugars become normal even without insulin because of the hormonal changes. It has nothing to do with weight loss. In first 2 days, how much weight loss a person will have, but the sugars become normal and insulin can be stopped. So when you ask me whether the diabetes bariatric surgery reverses diabetes, yes, in a way that is correct. Now the person is free. I don't know whether somebody in your family is taking insulin, because those who are on insulin have a restricted lifestyle. If they are traveling by road and they want to eat dinner at 1 o'clock in a roadside restaurant, they will have to get their blood sugar checked, then they will have to take insulin dose, and then they will have dinner. Now after bariatric surgery, all that is not required, because you are off insulin. You do not need to check your blood sugar every time before a meal, and you do not need to inject insulin every time. So it gives a freedom to a patient which is unheard of as far as medical management of diabetes is concerned. All right, so we have one more question from Tina, and a very relevant question. Tina, how safe is bariatric surgery? Tina, I think I have answered this during the presentation, but to tell you again, bariatric surgery has become very safe over years. And now it is as safe as getting a hernia surgery done. So if somebody, a man or a woman, has a inguinal hernia, and that hernia is managed with surgery or laparoscopy, the risk is the same as in bariatric surgery. And primarily it is because we prepare the patient very well. We optimize the patient, so we do all the kind of tests that are required. We optimize the patient in terms of breathing exercises, in terms of preparation, in terms of that we reduce smoking or stop smoking before surgery, or we stop alcohol intake or reduce alcohol intake before surgery. So all that helps in making the surgery safe. So nowadays the surgery related complications are extremely rare. I cannot say that they don't happen, but they are so rare that you can probably in good centers you can see them happening once in few years, even though they are doing very large number of surgeries. So I mean, categorically I can say the bariatric surgery is quite safe in our hands and in most of the busy centers. So if you have any more questions, please feel free to ask me, because now with the insurance and with the financing options, so those who do not have a insurance policy, healthcare insurance policy, there are financing options available for them, and these companies are able to give it like a consumer goods. They are able to give a 0% finance for these surgeries. So if you have any of family members who is suffering from diabetes and is finding it difficult to control, as I said, 60% patients are not able to control, it's a good idea to at least consult us, talk to us about the outcomes, and with the help of certain tests we can evaluate in advance how well the diabetes will get controlled in your patient's case. And I think this is really an eye-opener, because the heart diseases like angioplasty, or the dialysis, or kidney transplants, or brain strokes, all these can be reduced just because your loved ones or your friend blood sugars are better controlled. We are also available for online consultations. I'm aware that many of you are not from India, and online consultations can be easily organized. You can reach out to our program on somebody will get back to you within a day's time if there's a time difference, and you can call on 982 982-01-70763 or 982-01-70783. So feel free to contact, or you can send a mail on our email ID, which I had shown you, which is cmsbsoe@gmail.com. I'll repeat it, cmsbsoe@gmail.com. Center for Metabolic Surgery, Bariatric Surgeon of Excellence @gmail.com. So it's a short form of that, cmsbsoe@gmail.com. So thank you so much. If you, I hope that today's program had been of help to you, and we'll be very happy to provide you information. It's not necessary that each one of you should undergo surgery, because obviously medicine is a good option. But if that is not working, then surgery should be considered a suitable option in those patients. So thank you so much. Take care. Have a good day.